Hi everyone, so I'm currently in Fresno and my face is all done because we had to go to an event this morning. But I just wanted to just sit down and film for you guys how my surgery rotation went and how confused and crazy this whole process is. Why do I keep saying So it's now December, and by this time you should already know what you want to do with your life, what kind of real doctor you want to become, because if you do want to go into surgery, all the audition rotations that you're supposed to go on in your fourth year will be all filled up by third year. So I don't know if you guys are understanding where I'm coming from. Maybe I should start out by telling you how my rotation went. Yes, I would go there instead. So I was on a 6-week rotation in Yakima with Dr. Cundiff and Dr. Good and two other close medical student friends, and they are awesome. And then this lady is gonna come out and watch me talk to myself. It was beyond amazing. I had a 6-week surgery rotation with two of my best girlfriends. They're so funny and great to work with, and I just had an awesome time with them. We jived really well. We communicated and we talked about what we wanted throughout the whole surgery rotation, you know, and so there was no drama there, which I'm so thankful for. We worked with 2 surgeons and we saw all of our patients in the hospital and at clinic, and this was the first rotation where I was really sad that it had to end, and it was the first time that I felt tired, but the days never felt long. I would work from 7 a.m. till 1 o'clock at night, and I think the average amount of hours we would stay at the hospital was about 15. And I never complained. I never thought to myself, oh man, I want to go home. Like, oh, is this gonna be over yet? You know, like I never thought that. And it's scary because I loved it so much. And I was talking to my 2 friends who were doing the rotation at the same time with me, and they were saying the same thing, how they fell in love with surgery and how they're so scared, and the lifestyle that it brings and all these things, like all the things that I've never thought that I would think about, I'm thinking about now, because I'm like, holy shit, like I really fucking love this. And I felt like I was betraying all the things that I loved before I found out that I love surgery. So rewind to let you know, guys, know why I'm so scared is because around this time it's like December, and so you have to be thinking about what you want to do as a real doctor and when you apply for residency and stuff, because you have to start doing audition rotations and sub-Is in your fourth year. And so if you were to tell me a few years ago that I would be planning like a couple years in advance of what I want to do for the rest of my life, I would be laughing at you, because I was bartending back then and just trying to remember orders and not fuck shit up, you know? But yeah, so I'm really struggling with that right now, because growing up, to be honest, I wanted to be like Britney Spears. I wanted to sing, I wanted to dance, and then when I realized that that was so unrealistic, in high school, I took this class, this physiology class, and we dissected a mink, and then I realized that I was really good with my hands, and I love the biology part of it, and so I decided to apply to college with a biochem major. And I always told people that, yeah, I love surgery, you know, I'm gonna go into surgery when I become a doctor. But a part of me just thought that I said that just because it sounded cool. And when I was in college, I still, like, I minored in dance just because, like, you know, just in case. And I thought it was fun. But I started volunteering at the hospital in labor and delivery, and I really loved like the whole aspect of that part. And so I was like, oh yeah, maybe I can go into OB, because I can do a little bit of surgery and I still have a little bit of clinic and still have patient care and all that stuff, and I still get to deliver babies. So I was like, oh yeah, best of both worlds. And then I found osteopathic medicine, and I learned about OMT, and I learned that I am fucking badass at it, and And then throughout my medical career, I was just like, I want OMT. I want to apply it in my practice. I don't care what the hell I do, but I know I want to incorporate that. And so now I just feel like if I become a surgeon, I'm betraying all that. And I don't know, I'm so overwhelmed about how much I love it and how much I can see myself doing it. But at the same time, I want a family, and yeah, all these minds are rushing through my head. I'm sorry if you guys can't keep up, but because I'm super confused about what I want to do too. So yeah, that's what's going on with my surgery rotation. We did, so within surgery on its own, if you want to do well, read up on gallbladder disease, read up on small bowel obstructions, read up on hernias, know the anatomy, know the pathophysiology, know all the terms of the disease process, and know what type of imaging you would do, know the recovery time and stuff like that. And those are suggestions to do well, because usually the doctors like to pimp you on things like that. And if you just Google common pimped questions, you'll find a lot that's really good. And also learn how to one-hand tie. I can link a video below on where I learned it, but it's fairly easy, and it's so much better than the OB two-hand tie. Let me tell you, I will never go back to the two-hand tie. It's always going to be one-hand tie from now on. But I'm so sad that it's over, and oh my gosh, I'm so confused. I'm really confused. I would describe it as falling in love with someone who you didn't think you would ever fall in love with within a 6-week time period, and you have to decide now if this is the person you want to get married to for the rest of your life. And sure, you can, if it doesn't work out, you can get a divorce, but who the hell wants a divorce, and who the hell wants to start over in something new? And it's not only that, you have to realize, and just because you love them and just because you choose that you want them doesn't mean that they'll love you back, and doesn't mean that they want you back. So even if I choose surgery residency, how do I know if surgery is the one for me? And even if I do want this, what are the chances of me getting in? Because I looked into some residencies, and there's only 2 places in California. One's established and one's fairly new. Both of them only take 1 student. So imagine everyone in the world applying to these 2 places, and they only choose 2 people a year. And there's more in the Midwest and more on the East Coast and stuff like that. And I don't mind where I go. It's just, it's a lot to take in. So if you guys are going through this, or if you know, I just want to hear your story. I want to know what you think and how you decided what you want to do with the rest of your life. It doesn't have to be medicine. It could be anything, but yeah. So comment down below. Thanks for listening, and please subscribe for more videos. Bye.